The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to Local Women's Aesthetic Podcast. I'm Emma Heaney from Elite Aesthetics, and today I'm joined by two lovely guests. I'm joined by Amanda, which is a product specialist for Teoxane, and also Dr. Karen McConnell, who is a dentist, and she's a senior injector and an educator at Dr. Bonny's clinic and also Dr. Bonny's Academy, isn't that correct? And also, Dr. Bonny's clinic is the only, maybe you should give the title.
It's the only clinic of excellence for Teoxane in Ireland.
So today we're here and we're talking about, if you haven't heard already, the whole hype about Baby Glow. So who better to talk about it? Amanda, tell us about Baby Glow.
Baby Glow is a new treatment protocol by Teoxane. It's using 3 ml redensity 1 syringe. It was designed to meet the demand for the immediate glow and wow factor that patients wanted, but also the long-term skin quality improvement. And we have managed to deliver on all of those.
Excellent.
I think it's also really important to say that this isn't a new treatment. The product has been around in Teoxane's toolkit for very many years. It is just a new protocol which has been designed to give minimal downtime to increase the patient's comfort during the injectable treatment.
And as you said there, it's an injectable treatment.
Yes.
So, and it's redensity. Yes. How are we creating this result with this treatment?
It's just 8 injection points across each side of the face. It's across 4 anatomical landmark lines, so it makes it a very quick treatment, as Karen said, minimal downtime and minimal pain for the patient also.
So who's the ideal patient for it, Karen?
Everyone, anyone who has skin. So for me, from an injector's point of view, it's really good for anyone who is starting off their treatment journey. So people who haven't had any filler treatment before, who are a wee bit anxious about it, want to notice an improvement in their skin quality, but doesn't want any structural change. So from that side of the spectrum, it is really good as a starter point. But also further down the line, for those who have had their injectable treatments already done, who are happy with their facial volume, but just want something to improve their skin quality on top of that. So it helps just make the skin more hydrated and give more of an overall glow.
And so we talked briefly there about the treatment protocol. So how many treatments do you need?
So it depends on the age of your patient. So we have 2 different protocols. For patients aged between 20 and 35, we recommend 2 treatments, week 1 and 4 weeks later. For the more mature patient aged between 35 and 55, it's 3 treatments. So week 1, 4 weeks later, and then 4 to 6 weeks later. The perfect time for your maintenance then would be when your patient's coming back for her toxin, so every 3 to 4 months.
And when you were saying 3 to 4 treatments, how comfortable is it, Karen?
It is extremely comfortable. So compared to other treatments that have a lot more downtime or pain associated with it, it is very minimal pain. So there's lidocaine within the product. So as soon as you start injecting, that starts working. So the pain is very, very minimal with it. We also use a tiny 4mm needle, which increases patient comfort as well.
We talked off camera, you can have one treatment, but it's very much a Cinderella treatment and you're not going to get the longevity or the investment, I think.
Absolutely.
Yeah. So I fall into the second category then. I'm a 3 treatment girl. So it's really exciting. There's lots of buzz about it. You've marketed it so well. And I'm delighted that you have come on to talk about it, because even in my clinic in Elite, we're getting lots of questions about it. And as I've said to you off camera. So how can we move forward with this? So if trainers, or how do we get training for this? So if there's nurses listening that want to do it in their aesthetic clinic, how do they get in touch with you to do the training?
Hopefully most people will be able to reach out to a Teoxane, somebody who's already using Teoxane, or ring Teoxane, and then I can reach out to them personally, arrange a Zoom or a one-to-one meeting. Yeah. All of our training sessions going forward, we will be doing a Baby Glow demonstration at the start and at the end, or at the start or at the end. And we will be offering more hands-on training. However, it is a very easy treatment to do. And with all the assets that we make available to our injectors, you have really everything that you need after Zoom to offer Baby Glow in your practice. You know, you have everything you need, from, you know, step-by-step guides, your social media posts, your everything and more.
Amanda, could you explain to me what makes it different than all the skin boosters that are on the market?
So there is lots of skin boosters on the market, as we all know, but what makes Baby Glow and Redensity 1 different is it really ticks all the boxes from a practitioner's point of view and from the patient's. So we have a high concentration or volume of non-cross-linked hyaluronic acids, 45 milligrams, but we also have the derma-restructuring complex, 8 amino acids, vitamin B6, copper and zinc. We've got a treatment now that can deliver less pain, really quick with maximum results. So it really ticks all of the boxes. So yeah, it's completely, it's going to be a game changer. It's going to be a game changer. It is a game changer.
And how would you describe this treatment to your patient?
I always like to use an analogy with anything whenever I'm describing things to patients, because I think that helps them to relate to it. So I describe it like watering a plant. So you can water a plant and it will grow, but if you give a plant plant food, it's going to grow greener, it's going to flourish more, it's going to look more radiant and thrive better. And that's exactly what your skin is going to do with Baby Glow. It's going to encourage type 1 collagen production, type 4 collagen production, fibrillin production and glycosaminoglycans. So that then is going to encourage your body to produce its own natural hyaluronic acid as well. So it's just going to give that real boost and glow to your skin.
You did a fantastic presentation at the recent Bandman event as well, so thank you for that. So I've got to, obviously, I always put out to my listeners, I'm going to have you on, going to talk to you about Baby Glow. So we always do the quick fire questions and they always go down well. So do you mind partaking in a few of the quick fire questions?
No, that's fine.
Okay, so one for Amanda, first of all. What's the most exciting Teoxane launch today?
Well, Baby Glow, obviously. In my time, I only started a year ago.
What is your one skincare product you can't live without?
3D lip from Teoxane. Excellent. I love it. I just applied before I came in and my lips are so dry because I'm so nervous, but...
You're doing really well, doing really, really well. Karen, what excites you about Baby Glow?
Oh, I just think the hype around it, the glow that it gives, the instant glow, and how just luminous it makes your skin look.
Tell me this, what is the biggest misconception about injectable skin treatments?
Probably the pain associated with it. So I think that because a needle is involved, most people think that there is going to be a lot of pain involved. But actually the pain, as I've already said, is very minimal. And there's very little downtime. So you can go straight back to your normal life straight away afterwards.
So could it be like a lunchtime treatment and then?
Absolutely.
Lovely.
Absolutely.
And you know, we don't want downtime.
No.
None of our patients do.
That's exactly.
One word that best describes Baby Glow.
Glowing.
Radiance.
What treatment category will we see the biggest growth in for 2026, Karen?
I think the move towards regenerative treatments, I don't think that is going anywhere. There has been such a move. The 2026 patient now wants glowing skin, they want improved skin quality and focus more on regeneration. So I don't see that going anywhere.
And yourself, Amanda?
I think it's the realisation that not one treatment is going to fix everything. And I think patients are more open to realising they do need, skin quality improvement. They do need their toxin, they do need their fillers. And it is a 360 approach. And I think there's definitely a lot more people open to experimenting with that.
So to recap, if you're of the younger generation and you want a beautification, it's 2 treatments. Yeah. The mature ladies like myself, it's going to be 3 treatments. And a bit of help. If you want to reach out to your clinician to see are they offering the Baby Glow, and if you're a nurse, doctor, dentist listening, reach out to Amanda if you want to train in it as well. I think and also it's available in Dr. Bonny's clinic, and also you have your own clinic as well, which is KLS Aesthetics. Yeah, so here you've got loads of options. I'm excited to see where Baby Glow goes.
Yeah, thank you so much for having us.
Welcome.
Thank you very much.
Thank you.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.